counts down.
They do a countdown?
It counts down. Voila.
Hi everyone, welcome to Revolutionary Health. I'm Charles Stevens, the Executive Director of the Counter Narrative Project. This evening, I'm really excited because we are going to walk you through getting a physical. So we're with Dr. David Milbranch.
Yes, sir.
He's very doctory today.
I'm very doctory. Stethoscope, scrubs, straight out of Grey's Anatomy. Let's
And
go.
our very willing participant, Johnnie Kornegay, who is going to receive a physical.
Yes.
So, as always, please, if you're watching this on YouTube, subscribe to our YouTube channel. Also, we invite you to join our email list at thecounternarrative.org. And feel free to share your questions with us in the comments. And certainly use the hashtag Revolutionary Health to post questions on Twitter. Now, we're supposed to have our phones off.
It was no, the phone's up. It was the computer.
The computer was making
yeah.
Okay. So, David, would you
Yes.
mind telling us, like, what does it exactly mean getting a physical? Like, what is a physical? What are you going to do today? Like,
Right.
kind of just walk us through what we can expect.
Right. So I'm an internal medicine physician, and for those of you that don't know what an internal medicine physician is, we're basically doctors for adults. So anyone over the age of 18, we handle stuff like diabetes, asthma, HIV, all these kind of other things. So we have a lot of things that we do, but it's kind of a pediatrician, but for adults, right? So what we usually do is bring somebody through for a physical, a history and physical. So the history just means we ask patient a lot of questions. We'll ask, like, what brings you in today, your past medical history, your family history, what medications you're on, your social history, which include, you know, where you're from, work habits, sexuality, sexual behaviors, tobacco, alcohol, or other drug use. And then we ask about medications and what allergies you have. And then we go straight to a physical exam, which is kind of like a head-to-toe thing that we do, and kind of checking everyone out. And it's more of a preventive thing to make sure that someone is okay. And so with men, when we talk about men, there are a lot of age differences that we see now. So usually if you're 18 to say 30, 35, the thinking now is you probably only need a full history and physical once every 2 to 3 years. And so those days where it used to say you have to go every year to get a physical, if you're relatively healthy and don't have any problems, you don't have to go to get a full physical every year. And so we're starting to kind of launch into this thing that if you're over 35 or getting close to 40 or have other medical conditions, that's when you should be getting checked out by a doctor at least once a year. Now, will any doctors push you away, or nurse practitioners or PA, if you come in once every year to get yourself checked out? No. So I would encourage you, if you're comfortable with that, come in once a year, see somebody, make sure they check you out. But if you don't like going to the doctor that much, realize that if you're younger and healthy, you can go maybe every 2 to 3 years, and then, you know, just come in as needed when you have something wrong.
Thank you, David. So, yeah, I guess we'll jump into the physical. Johnny, how do you feel?
I feel good. And I think this was, thank you for sharing that information.
Notice that so David, what did you just do?
I just went to wash my hands with alcohol dispenser. If a doctor doesn't do this, but don't judge a doctor when they come in and if they don't wash their hands, because sometimes the little dispensers are outside the room, so we wash our hands before we come in the room. But you want to make sure a doctor washes their hands before and after they do a physical exam.
Okay.
Thank you. I had a question, but no, we're good.
No, we're ready, sure.
We had a question from Daniel. He wants to know if it changes if you're living with HIV in terms of how often you should get your...
Yeah, with HIV or other chronic medical conditions, usually with HIV, what you're going to do is come in, used to be every 3 to 4 months, but if you're on your medications and you're undetectable, we stretch it out sometimes to every 6 months if you have a year of being undetectable. And a lot of people actually now stretch it out to once a year if you've had 2 full years of being on meds and undetectable. Again, these are kind of more like general guidelines. I think each clinician works with their patient to kind of have them come in and see them as much as they want to. But with HIV, obviously, thank you, Daniel, you want to be seen a little bit more frequently than that.
Thanks, Daniel.
Okay. All right. So the main thing that I do when I first start, and most providers, nurse practitioner, PA, or physician will come in, is just kind of take a general look at the patient. And so you're just looking at them, how they seem. Do they seem uncomfortable? Are they laboring? Are they having any trouble breathing? Those kind of things. And then what we do is kind of more of like a quick exam to kind of see if you're with it. There is something called the mini mental status exam where you ask a whole battery of questions to see where someone's mental status is. But usually, like with Johnny, I could come in and just say hello, shake his hand, be like, hey, I'm Dr. Milbranch.
I'm Johnnie Kornegay.
Very nice to meet you.
Nice to meet you.
What's going on in the world today?
Foolishness and mayhem. Actually, I've kind of been in a bubble, so I'm not really sure what's in the news today.
Yeah, so even when you just
The weather's bad.
The weather's
Hurricane
bad. Hurricane Michael. So when he says something like that, I'm kind of assessing. Some doctors will use like 3 questions. Tell me your name, what year it is, who the current president is, those kind of things, just to assess their mental status. The next thing I'm going to do is just kind of look at his scalp and his face overwards, take a look over, just make sure there's no bumps, bruises, anything like that. And then we do a kind of component of the exam called the HEENT. It stands for head, eyes, ears, nose, and throat. So I'll kind of walk you guys through that now.
So what's that device you have in your hand?
It's an otoscope. And so this basically will double as looking at the eyes as well as looking in the ears, so I'll show you. So I'll have Johnny look straight ahead at the wall. And what I'm doing when I bring the light in is I'm kind of looking to see the pupils will kind of diminish in size when bright light comes about. And what's neat about this is that even when I put it on that side, this side should constrict as well. So when you see a doctor, they'll do it twice on this side. They'll check to see this side constricts and then check to see if this side constricts as well. And you do it both with both sides. And then we do something called extraocular movements. There are muscles that pull the eyes everywhere. So I'll take them through like this. So Johnny, I want you to watch this with your eyes. Just with your eyes, don't move your head. Okay, now you follow it into your nose. Keep watching it, keep watching it. When I did that, did you have any blurry vision or anything?
When it got like super close.
Super close to the, okay, that's fine. This is another instrument called an ophthalmoscope. You may or may not see a lot of doctors use this, but this is something that looks deeper into the eye, and so you can look at the optic disc, which is the main nerve that comes about. Sometimes what we'll do, we won't do it here, but we turn the lights down or we dim the lights. We have you look straight ahead, and then the doctor will get real close, which is bad if they have bad breath from coffee or something like that. Unfortunately, I just had some gum. And so what you're doing is you're kind of looking at the blood vessels, so someone with high blood pressure, diabetes, and I would do both sides with that. And so this is an ophthalmoscope. If you go to see an eye doctor or an optometrist, an ophthalmologist, what they do is they put those drops in your eyes to help dilate your pupils so we can get a better look in. Sometimes when you go to a primary care doctor, we can't dilate the pupils, so therefore we actually can't see in the eyes that well.
Okay.
So the next thing that I'll do, I tilt Johnny's nose up, and in Atlanta we have a lot of allergies, so I'm going to look in the nostrils. And what I'm looking for is to see if there's any congestion, inflammation, snot that he hasn't cleared out, things like that, and we'll see exactly what's going on with it.
Yeah, I'm sure there's some congestion because I typically have like chronic allergy stuff.
Yeah, and so like this is ragweed season in the fall. People think about pollen in the springtime, but ragweed season causes the same allergic reaction. Now, let me see if we have one of these over here.
As you can see, David is grabbing a
Tongue depressor.
tongue depressor.
And so this is your tongue depressor. If I could open this.
It's like, no.
Yeah, of course, lots to do. So
I'm
sometimes
such a bad assistant. He should fire me.
I know, right? So what you're gonna do is you're gonna look into somebody's mouth. So open your mouth for me, Johnny. Now say ah. Okay, good. Lift your tongue up. So what we're doing is we're inspecting the teeth, and we're kind of looking at the gums. We look at the top part and the bottom part.
What are you looking for exactly?
Any kind of irritation around the gums. You look in the back of the throat, you can see the tonsils. You can see all those things that are there.
Where's back here?
Let me see that too. Sorry about that. And so you can see all those things in the throat. And you kind of look, if you see somebody with strep throat, you can see it back there. If you see somebody with obstructive sleep apnea, if they're having trouble breathing, you can see if there's a lot of tissue back there. All these things you can kind of look at while you're there. But the tonsils are back there, the back of the throat. And you're just looking to see if there's any ulcerations, any lesions in the mouth.
So you're really serious about the head to toe business. Like you really do a thorough
You have to. And then,
check of all things.
of course, your otoscope is used for a few different things, so now we're going to look in the ear. So you just pull the ear lightly like this, and the doctor's just going to take a look in. And what we're doing when we're looking at this, the eardrum is on the inside of the ear. And what we want to see when we put the light against it, assistant, if you want to put that in there.
All right, I think I can
You think you can manage that?
I did it! Oh my gosh!
Excellent job. So
I did a lot of validation.
what we do is we look at the eardrum, right? And so when we're seeing it, we want to see there's a light that's coming from the otoscope that looks against it. Okay. What we're looking for is to see that the light reflects back. Like if you flash the light into a window, if someone has an ear infection deeper in the ear behind the eardrum, it'll be dull. So you won't see the reflection, you'll see something bulging. So that's why we look in the ears, and we'll do both.
I'm sorry, before we go much further, we should have asked this in the beginning. Before someone gets a physical, what should they do to prepare for it?
Good question.
Okay, so
Like, what should they wear? Are there particular? I imagine they should do the basic hygiene stuff.
I think it's just basic hygiene, and it depends because obviously, if you're going to have a rectal exam, and if the doctor's going to do a digital rectal exam when they put the finger in, just make sure everything's cleaned out. You don't have to douche or use an enema like you would if you were going to bottom for somebody, but just make sure everything's clean in that area. And just make sure you're clean. You can wear shorts and a t-shirt, you can wear a suit, but the thing is, so what I do with a physical exam, I don't make people get butt naked and then go behind one of these gowns before because it's really embarrassing. So what I do is that if I'm going to do a genital and rectal exam, I just have them pull down so I can take a look. So sometimes it takes a lot of time to make somebody take off all their clothes and then get behind this, and then they're embarrassed because it always leaves your ass out in the back. So just in consideration of that with my patients, I won't do that often.
Unless they want to.
Yeah, unless they want to, unless they're really excited about that for some reason. So, which I don't know why they would be. But the thing is that when you do this, you don't really have to wear certain clothing or have a certain outfit on. Just come and be clean. And a lot of times if you're getting labs drawn, don't eat anything for about 9 hours before. That's called fasting. So they're checking your cholesterol for fasting.
Does it include sleep? So you like 9 hours the night before?
Yes.
Okay.
So if you had an appointment at 9 o'clock in the morning, don't eat anything at midnight. Or midnight or after, and you should be fine.
Quick question about, so these gowns are like paper.
Right.
So for men of size, I'm fine with this. Well, because when I'm wearing my shorts and when I'm wearing a shirt.
Right.
But for men of size, is it okay that I request 2 so that I can
No, people do that all the time. So you can ask for 2 so you can put one over the back and one over the front just to make sure you're kind of covered.
Perfect.
And that's not a problem at all. They should at least allow you to do that. But like I said, sometimes in my history of physical, I don't even use these gowns. I just kind of examine them and then lift up, take a look at what I want to see, and then go from there. Okay. So what we're going to do now, we're going to look at 2 things. So the thyroid gland, which is the gland that produces the hormone that regulates your body's metabolism, like how fast your heart rate is, what your mood is, your skin texture, your hair, all that kind of stuff. Your gland is right here. It's kind of shaped like a butterfly right around your Adam's apple. So what I'm going to do, I'm just going to feel it, and then I say, Johnny, pretend like you're swallowing some water. Okay. And so usually if someone has like a thyroid condition, whether it's too active or underactive, you'll have what's called a goiter, which is a large enlargement of the thyroid right here. And sometimes you can see it just from entering the room, you can see it. But you feel it, you should feel the thyroid kind of move up and move down underneath your fingertips. The other thing that I check is for lymph nodes. So you have lymph nodes that collect inflammation cells when you have an infection. They're all under here, they're under the chin, they're in front of the ears, they're behind the ears, and then they're over the clavicles here. So usually I check, and I'll usually walk a patient through, I'll say, okay, I'm checking for lymph nodes now, and I'm making sure everything is okay. So they at least know, and what I like to do is kind of talk. And sometimes when I'm doing the exam, I'll ask other things. And so I'm about to do the lung exam now. And so, there'll be medical students that could watch this and say, hey, he's not doing all the lung exam components. I'm not going to do it.
We're doing it somewhat condensed.
So someone's watching this.
Don't call me a supervisor.
He's not doing everything he's supposed to do.
Because there's probably spraying pants.
We have about a half hour with these questions, so I just want to make sure we get kind of through the major things.
And I told David he couldn't do. David fought me because he wanted to do all this stuff, and I was like, yeah, we condensed. It was a brutal fight, but
it was a brutal fight, but Charles won. All right. So Johnny,
lesson to all of you.
Take a nice deep breath in. Blow out your mouth. Okay, again. Blow out. Good. Keep going. Blow out. One more time. Blow out. And so when Johnny's breathing like that, and it's important for him to breathe in and out of his mouth because then we can hear the air going through the lungs. So with someone who had asthma, we could hear like those wheezes that someone living with asthma gets. Or if you have a pneumonia, we may not hear air flowing through. So we're listening to both lungs from the top to the bottom. Some people will listen at the front as well, just to see if they can do that as well. But you can hear things like pneumonia, asthma, chronic obstructive pulmonary disease or COPD. You can hear someone's dropped the lung, which is called pneumothorax. All those things are kind of important.
Okay.
That makes sense?
Do we have any more comments or questions?
We had one earlier. Someone asked, what would you suggest if you don't have insurance? They were just talking in terms of the frequency of...
Yeah, I think we should probably follow up with that person in the comments.
And also it's a good question. The recommendations are going to be different based on insurance.
Yes.
But you'd have to go to like one of your county hospitals that provides Medicaid or something like that if you don't have insurance or you don't have enough money. But those recommendations do not change, saying like, oh, well, you should just not go see a doctor for 5 years because you don't have insurance.
So a physical is a physical is a physical.
A physical is a physical no matter what the insurance is. So don't worry about that. But you have to kind of do a hustle to kind of get to a provider that will accept patients without insurance.
David, I wanted to ask, particularly for folks that might have a history of, sexual abuse or involuntary sexual debut, and thinking about especially how Black women are impacted. I imagine it can be very triggering. Some of the stuff that happens in the physical, I guess, in any routine, medical visit, but definitely physical because there's so much vulnerability.
Right.
If I am someone that has that history and background, should I communicate that to my doctor before I start? Like, how does one that might have experienced like sexual violence or?
Yeah, I think that's a great question. And so, for any of us out there who have experienced sexual violence as a child or even as an adult, I would encourage you to mention that during the history, especially during the social history, when you're talking about your sexual history, your childhood, sexual behavior.
Because the doctor's not going to ask that outright.
Doctor may not ask that outright, but if you feel empowered and say that, that will help give them more context. And then see, like sometimes what a doctor should do is explain things as you're going along. So I'll usually explain before I start, like I would say, Mr. Kornegay, I'm going to do, the exam I'm doing is going to include a genital and a rectal exam. I just want to let you know about that. And if I can see by their face, they kind of go, I was like, okay, I can tell you weren't expecting that. And some patients will just say flat out, Doc, I didn't prepare. Like, I went to the bathroom before I came here, and I'm not going to let you run my ass. And I'm like, that's fine.
Wow.
We can do it next time. And it's very real, but you have to, if a provider is watching this, you have to give the patient the power to do that and say, the patient has some agency here too. So if you don't feel comfortable doing a part of the exam at that day or that moment, you can always come back later and do it later, especially if you feel you aren't clean or you're just not comfortable with it just yet.
So that you're saying that even if I'm going through a physical, I can actually say no.
Yeah. You can bump it off and say you'd rather do this at a later time. Just like with your history, I've had patients, when you ask about a sexual history, they'll say, Doc, you seem real great, but I met you for the first time today, and I don't feel comfortable talking about that. I say, oh, that's fine. I said, we can talk about that next time if you want to. And usually most patients be like, okay, cool. But that's the way it should be. It shouldn't be like me forcing you to do stuff that you're not comfortable with.
Because I've definitely had doctors that have just been very
we have to be
forceful. Yeah.
I mean, obviously, if something physically is happening, like with Johnny, if you said this, and I had to put my foot down, I would. But if it's something where it's an option, it's a matter of comfort, like I'm going to defer to the patient. Because I want the patient to come back to see me. So if I make them comfortable at the jump, they're not going to want to come back and see me. So I want to make sure that he's as comfortable as possible.
I had a quick question. So I know that we're doing a physical exam. Are labs part of the physical automatically?
Not automatically. It just depends on your age and kind of what you're doing. So like if someone comes in and they're 21 years of age, with HIV, obviously you're going to have a certain amount of labs that you're getting. With someone like Black gay men, we want to check to see how often you've been sexually active and get STI screening. That'll be regularly. But things like cholesterol, blood tests, like kidney function, blood counts, unless you're on a medication that could affect that, and if for someone who's HIV negative and say on PrEP, we check these things kind of regularly, but usually we don't check that much. If you're HIV negative, not on PrEP, you're just going in to see the doctor's office, and you're below the age of 35, you may not be getting many labs each time. Or with me, I'd only get them once, and then if you're 21, 22 and seeing me for the first time, whatever your age is, if I see you for the first time, I may get that baseline labs.
Yes.
And then unless something's wrong, I probably won't do it again until years later.
Absolutely.
Okay.
And I know we're going to move on to another section, but since I just turned 41,
right.
What are some things like that old men, especially Black men over 40?
Say old men? Right. So, Black men over 40, it depends. Like, if you have a history of prostate cancer in the family, like your father, you probably should be getting a digital rectal exam to feel the prostate once a year, getting a PSA test, which is a prostate-specific antigen test, which is a blood test that you take. Routine labs, like once a year, if you're coming once a year at 41, would be a complete metabolic profile, which includes kidney function, your liver test, electrolytes like sodium and chloride, those kind of things. And then also a blood count, which includes like your hemoglobin, your white blood cells that fight infection, those kind of things. And then cholesterol usually starts around 35. Unless you have a family history of early cholesterol, like family history of cholesterol off the charts, you would get it at a younger age. But usually, all things being equal, it'll be about 35 that you'd start to get that.
Okay.
No, go ahead.
But, so I have been a man of size like my entire life.
Right.
Would the doctor order? Because I know that I had my first cholesterol exam or cholesterol test probably in my late 20s.
Right.
So that was kind of
reasonable.
Which is reasonable.
Yeah.
Okay, perfect.
I wouldn't worry about that. Okay, so I'm gonna take him through. I'm gonna have Johnny lie back a little bit.
That's gonna keep it fun.
Oh, Charles. Okay, so what I usually do, I'll lift this up and I'll lift up the shirt too. And what I'm going to first do is listen to the heart. And for the medical students, we have a bit of string here, sorry. So what we do is kind of feel where the heart is right here. So we can feel like what's called the point of maximal impulse, which is we just want to feel with our hand where the pulse is being the hardest, which is usually right over here by the left ventricle. There's 4 areas of the heart that we're going to listen to here. I'm not going to bore you with the details of the names of each of them.
You know you want to a little bit.
But it's your right upper chest, kind of your left upper chest. And usually you want to be quiet when this is happening, so don't talk or else the doctor won't be able to hear what they're listening to. And this is called the apex over here of the heart is. So you should be able to hear if someone has a murmur, which means that one of the heart valves isn't working that well. You can hear if the heartbeat is irregular or irregular, if it's fast or too slow, all those kind of things. Now with the abdomen, you want to just take a look too and make sure everything is okay. You want to first listen, so the doctor should be listening to your abdomen, and all we're listening for is that you have bowel sounds. So we just want to hear that gurgling, almost like you're hungry. Yeah, I hear a little bit over this, so it's fine. What we typically are taught to do is do what's called light palpation and then deep palpation. So I would just say to Johnny, okay, I'm going to press a little bit on your stomach. Just let me know if you feel any tenderness. You should feel pressure, but not pain. And what you're going to do is lower abdomen here where the intestines are, periumbilical here. The stomach is up here, the liver is over here. So you're kind of pressing. People with heartburn, gastritis, inflammation of the stomach lining will usually have pain in here. If you have something wrong with your liver, it'll usually be on your right side. Appendicitis is down here, right lower quadrant. And then any kind of like inflammation of the colon, if you have food poisoning and your stomach's hurting you, it'll be down here. So after I press lightly, I'll press a little deeper and just make sure. And sometimes you can feel masses, sometimes you can feel other things, but you're basically seeing if they're tender at all or if there's any swelling down here.
And what are you checking for? So if there's tenderness or swelling, what would that
Yeah, tenderness, whether the liver is inflamed, whether there's some inflammation here, whether there's some kind of mass or something that's in there that would cause a little bit of pain, so those are the things you're looking for. And then what I do is I check the liver. Sometimes you can tap it out. If you hand me that,
this?
yeah, the reflex handle.
And the water.
The reflex handle with the orange tip.
Okay. So make sure I'm holding it correctly. So I'm passing.
So sometimes what we'll do is we'll tap.
It's like the Flintstones.
And it should be hollow around here with the abdomen.
And then when you start thumping?
When you start to feel the liver, it gets a little bit more dull because as you're tapping, it's like using sound waves. You can't tap through dull stuff. So I tell Johnny, take a deep breath in, blow out your mouth. You feel any pain in there? Okay. So what I'm feeling, sometimes you can feel the tip of the liver, sometimes you can't. On the left side, sometimes, thank you, assistant. You can feel for the spleen, which is an organ over here that kind of collects a lot of inflammatory cells and blood cells. And so sometimes you can feel it down here. Sometimes it'll be enlarged if someone has sickle cell disease. And usually by the time they've reached late teens to 20s, that organ has kind of blocked itself off because the sickling of the red blood cells basically causes it so that it can't get blood flow to the organ, so the organ will basically shut down by itself. So, okay, so we're done with that.
Thank you, Johnny.
We're going to have Johnny sit up.
That was awesome.
What we also do with the heart exam is we'll check pulses, and I forgot with the neck part too, you've got 2 carotid arteries here. So if you're older, think about when you have heart blockages with the blood flow to your heart supply. You also can have these 2 carotid arteries right here get blocks like cholesterol plaques in them as well. And when you listen, you can hear like a blowing through it. The reason why it's important is that sometimes if people don't get enough blood flow up here, they can have a stroke.
Wow.
So when you're older, you want your doctor to kind of listen on this. So I would say, Johnny, hold your breath. Breathe. And then I could just hear the pulsations from this. Hold your breath again. Breathe. But if it's abnormal, or think about it like fluid trying to go through a straw, it's going to sound more like a blowing. It shouldn't be like bum, 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 bum. It'll be like, so you can hear that sound going through. What I also check is pulses. So you have the radial pulses right here. Those are both bounding. And then for his feet, you check what's called the dorsalis pedis pulses, which are down here.
You have pulse in your feet?
Yeah. There are pulses like behind the bone here, the malleolus bone here, and then you have pulses right here. So if you feel, and sometimes when people get really sick, and when they're in the intensive care unit, we actually put IVs through their feet, or we do like what's called an arterial line, where we measure their blood pressure like through the artery itself.
Okay.
And so we leave something in there for that.
Are there any questions? I don't want to ask if there's anything as a stupid question, like, are there questions that people might be apprehensive about asking that you just speak a little bit about the importance of like people asking questions?
Yeah.
Not being afraid to ask questions.
Yeah, absolutely. And one of the things too is also, like I said at the beginning of the exam, I tell people that like I'm seeing you for the first time. I'm going to do a genital and a rectal exam. Obviously, we won't take Johnny through that on Facebook, or we'll
get shut down.
We'll get shut down immediately. So that's
check out Liberty Health Uncut.
Right.
Premiering at 11 o'clock.
Untucked and uncut. So what I would usually do
with OnlyFans page.
Right. What I would do with the genital exam is you're basically going to look to see if someone's circumcised or they're uncircumcised. You're looking for any kind of rashes, lesions. Like I talked about with the lymph nodes in the neck, there are 2 lymph nodes. They're called inguinal lymph nodes that will swell up sometimes if you get an infection. Gonorrhea, chlamydia, those kind of things can swell up down here. And then especially for guys under 30, you want to make sure a doctor actually checks each testicle. And what they'll do is a testicular exam.
Okay.
So they examine your scrotum and each testicle. They should be feeling them to just make sure there's not any masses, it's not tender, painful.
We're actually doing a show on that at some point.
Yeah, I think we're doing a show on testicular cancer stuff. But 63 or 67% of testicular cancers happen in people who are under the age of 30.
Wow.
So that's what a lot of guys don't know. So I work with a lot of student health populations. So once you get older, your risk for testicular cancer goes down. But as you get older, your prostate issues can come up.
Yeah.
And they're 2 different organs. The testicles are in the scrotum. The prostate is up deep inside you, like wrapped around your urethra, which is just your peeing and coming to. So at any rate, a couple of the things I would do if we have time.
I have like 3 minutes.
3 minutes. So I would do a neurologic exam, and I would also let me go back to the genital and rectal exam.
Should I give you something?
Huh?
But they gave you something?
No. No, we can kind of go through quickly. But what I would say to you is this. We don't always go through neurologic exams as physicians and PAs and nurse practitioners, but we should be checking all the cranial nerves in your brain, and there's a battery of small tests that we'll do. We should be checking your strength, like your grip strength, like I would ask Johnny to grip my hands, I'd ask him to push against me. I would check his reflexes as well, so I would just have him just relax your legs completely limp.
We've seen that on TV a lot.
Yeah, you see this on TV a lot, and you'll see those reflexes.
Oh, that's
kind of
interesting
happen.
how...
Yeah, it's a circle arc. It goes back to the spinal cord and then back here immediately. So that's what the reflex is. That's why it just kicks automatically.
Wow.
And so that wasn't a full neurologic exam by any stretch of the imagination. We'd have Johnny walk. We'd have him walk on his tiptoes, walk on his heels.
I don't know, should we do that? Johnny,
no, let's not do that today. Just for the sake of time. And so the other thing I will say, like for the genital and the rectal exam, no matter your age, when you see a provider for the first time, have them look at everything. And if you get the sense that they're just trying to rush you in and out, have them stop them and say, hey, you're seeing me for the first time. I need you to take a look at everything. And for the younger guys out there who are probably less than 40, less than 45, and don't need to have their prostate checked, they don't need to do the exam where the doctor puts their finger in your anus, but they should take a look on the outside. Why? Because you can see things like herpes, warts, any kind of abnormalities that you may have back there. Just make sure that everything is okay. After that, they don't have to do that every single time you come in.
Yes.
You don't have to do a genital and rectal exam every time, but make sure you ask them to do it at least once. So the job is to know your body from head to toe.
Yes.
And that was what you asked me before, like what's the purpose of the whole physical? It's so that provider can know the patient head to toe at least once, and then after that they have a baseline. So if Johnny comes in later and says, something's wrong with my foot, you'll look back to your notes and say, yeah, his foot exam was fine. Or, yeah, my testicle's swollen. Okay, his testicles weren't swollen when I saw him the first time. So you have a baseline by which to go for. That's the reason why you go through the whole history and physical. Not because you need to go through this tedium every time, but because it's a good practice to get into so the doctor knows your body, you know your body better, you can ask questions, and then if anything goes wrong, we can kind of refer back to what we did.
What should happen after the physical?
What do you mean?
So you get your physical, are there any things that happen, like when you leave, like what happens next? What can you expect?
So a lot of times, Alvin said we smoke cigarettes. Was it good for you too, Johnny?
It was great.
It was great for you, yeah. So
I no longer smoke though. So.
Right. So what we usually do is that we're getting labs, we'd send the patient to the lab. We would ask in the history, or maybe a nurse or a medical assistant would ask at some point, like, are you up to date on your vaccinations?
Yeah.
So for black gay men, like right now it's flu season, we should all be getting a flu vaccine. If you're living with HIV, meningitis vaccine, you should be looking into hepatitis B, hepatitis A.
I think we have an HPV vaccine now for people men over 18 now.
It's until you're like 26 is kind of the cutoff age where insurance will cover it.
Okay.
But HPV vaccine is a good vaccine as well. If you're older or if you're living with HIV or have diabetes, lung disease, Pneumovax, which prevents against bacterial pneumonia, is another vaccine to get. So there are a number of vaccines you can kind of look into. And then we think about other things, like if Johnny's over the age of 45 or coming to 45, or if you have a history of colon cancer in your family, we want to recommend him getting a colonoscopy. The prostate exam that we talked about before, whether it be the digital rectal exam where the doctor feels the prostate or we get the blood test, those kind of things happen as well. So, but usually after all those things happen, if you need any prescriptions, refills, stuff like that, we do that and then send you out to get labs and then you check out and schedule your appointment for the next visit. Cool. That's usually how it goes.
One quick question.
Yes.
So one of the things that you mentioned is that history, right? So I'm trying to think through if there are individuals who may see multiple physicians in multiple facilities. What's the recommendation on how to gather or keep all of your information?
Yeah, so one of the things that I tell people to do, and a lot of, depending on the practice, sometimes they'll have a patient portal where they'll have all that information. I know my physician that I see, he works at Northside Hospital here in Atlanta, and so we'll have a patient portal so I can communicate through secure message with his nurse, with him. He'll send me copies of the lab, so on and so forth. A lot of times, if you don't have that, you can either ask for it over the phone, ask them to fax it to the other doctor,
Perfect.
but I don't trust that a lot, so the best advice I can give you is get a copy of your records, which at the minimum should be probably your last maybe 2 visits,
Excellent.
a list of your medication, and all your recent labs. Keep that in a folder, or if you want to just screenshot it, take a picture of it, keep it in your phone so you can carry that with you wherever you go. That's probably a good idea. Like I said, you don't want to get into this business of sending things via email.
Yeah.
The internet's not secure, your information won't be confidential. So if you have a private patient portal, that's the best way. Otherwise, get a hard copy of it, scan it into a flash drive or on Google Drive or a Dropbox, wherever you want to keep it. But keep a copy of it somewhere with you where it'll be easily accessible. So if you're seeing a doctor or you have to go to the emergency room, God forbid, you'll at least be able to pull up some of this information that they have if they can't access the records from your primary care provider. So I think that would be it.
All right, gentlemen. Well, I am so glad.
Johnny, how are you
We covered a
feeling?
lot.
Johnny, how are you feeling?
No, this feels really, really good, and I'm glad that we had a chance to do this. I'm excited to see the feedback from everyone.
I'm glad we did too.
I'm glad too. And again, for our viewers, we hope you'll consider getting a physical if you haven't had one in a while, and when you go get your physical, that you ask some of the questions that we recommended.
Can I say one more thing?
Oh, please do.
So for all the black gay men watching, doctors, public health officials, the U.S. in general, globally, when they see us, they just say HIV, 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 sexually transmitted infection. They just see us as that. So it's kind of up to us to push the envelope and say, regardless of whether you're HIV positive or negative, whether you've had an STI in the past or not, focus on your general health. Like force people to look at you as an overall human being and get to know who you are so that you can know your whole body, because your body is a lot more than just HIV or just a walking risk factor for an STI. So make sure you empower yourself and educate the medical providers you come in contact with, because a lot of them, to be quite honest, are only looking about your sexual health.
Wow.
And you're much more than that. So make sure they understand that when you go into their offices.
All right. Well, again, folks, please subscribe to our YouTube channel, like us on Facebook, and join our email list at thecounternarrative.org.
Boss Magazine.
Oh, and our Alvin, our director, just reminded us to ask you to vote for the Counter Narrative Project. We were nominated for a Pause Magazine Award in the category. Revolutionary Health was nominated in the category of
Best Video Series.
Best Video Series. So please vote for us. You can actually find the information on David's Facebook. And
I'm going to be posting it a lot. So make sure you vote. There's a group from New Zealand that is trying to beat us.
We love them. Yeah. And we want everybody to win.
We need
and our Facebook page. So please check us out.
Yeah.
And with that, do we have any other announcements? Oh, and make sure you vote.
Make sure you vote.
All right.
Yeah.
Vote for us.
Thank you, everyone.
Thanks, everybody.
Bye.